Good day. 90% of the people who fail the MRCS Part B examination actually fail because of the knowledge, basic knowledge stations, not because of the clinical stations, because most of the candidates are actually doctors, they are surgical residents or surgical registrars or sometimes surgical specialists. So they know how to deal with the clinical stations. But the basic knowledge usually is the problem in the examination, the critical care stations, the anatomy stations, and the pathology stations. So the reason for the failure actually is in this, you have to pass both parts, the basic knowledge and the clinical, as you know. So the reason for failing this part, there are many reasons actually. The first reason is most of us has left the medical college for a long time, so these basics and this theory is not well memorized by us or remembered by us. Number two actually is the way of thinking in the medical college and the way of thinking as a surgeon to become a member of the Royal College of Surgeons is the way of thinking is different. So in the college, usually we think in a linear way. We memorize. So we open there and we answer the questions on the paper, and in the oral the questions are in the same way. But you need, and actually I think that is the main reason for failure, is we need to change our way of thinking. Memorization is important, definitely, but if you do not change the way of your thinking, it is difficult for you to pass this exam from the first time. And anybody who sat actually, I hope that all of you are going to pass from the first time, if this is your first time. Most of the people who pass in the second time pass because of changing their way of thinking. Okay, so the main way of thinking in the college is a linear way, just memorization. Here you have to think in something called branching thinking way. Okay, so I want you to imagine every station, everything that will show up to you in the exam as a tree. So in every station, in the basic knowledge, there will be a main stem like a tree, and there will be branches, and sometimes there will be mini branches originating from the main branches. Okay, so the third reason for failure is that many people cannot expect the questions, or because they are memorizing in a linear way, they may miss the answer because they are trying to remember. You are under stress, 9 minutes only. Either the question should be answered now. 20 questions within 9 minutes is too much. So you want to answer now, and sometimes your memory is not there because you are tense, okay? You are upset. It's a difficult exam. So you want to know the questions, prepare yourself for them, and know the proper answer that the examiner in front of you is waiting for. Okay, so this is the third way. So we are going to focus now in the weak part of each of us when we are preparing for this exam, which is the basic knowledge. And today we are going to discuss a station which is a very common station, actually, critical care station. And the main stem, as I told you, they are going to ask you about the main stem, and then they are going to ask you about the branches. So the main stem will be related to the main scenario that is going to be given to you, okay? And the main stem here is going to be a lady, an old lady, put lines below old. And this lady has a left iliac fossa pain. She has tenderness on examination. She is febrile, and they are going to introduce to you some labs and some ABGs regarding that lady. Okay, so if you know this station and expect it, you will not lose time in reading. Okay, you just check the WBCs, these things, ABGs, acidosis, and you are going to know everything immediately. So the main stem will be about the diverticular disease, diverticulitis, diverticular abscess. This is the main stem. Okay, there are other branches that we are going to mention in another lessons. Okay, but let us focus on the main stem. they may enter some questions from the branches here, but it is not important if you think in branches, okay? So the main stem is about diverticular disease. They are going to ask you 3 questions in the main stem, only 3 questions regarding the main stem itself. The first question, what is your differential diagnosis? Again, for answering every question, you have to think in branches. So there are surgical reasons, you are a surgeon. There are medical reasons, and there are gynecological reasons. The surgical reasons are 3. The medical reasons are 2. And the gynecological reasons are only 1 reason. Okay? Surgical reasons, they could be, this lady may have diverticulitis, right? The second reason, surgical reason, could be sigmoid volvulus. The third reason could be ureteric colic, because urology is a part of surgery, right? Okay. Medical reasons, 2 reasons. It could be acute constipation, and it could be gastroenteritis, right? Okay. The third, or the gynecological regions, third category, 1 reason. She is an old lady, so ovarian things are outside, okay? So you are going to mention only PID, pelvic inflammatory disease. This is question 1. What is your differential? Let us go to the second question. What is the second question? They are going to tell you that this lady had a CT scan and it showed a diverticular abscess. What is your management? Okay, so again, you are going to think in branching ways in the main stem itself. There are 2 ways to treat the abscess, diverticular abscess of this lady. First of all, logically, open drainage. Abscess should be drained, right? So open drainage is an option. Second is image-guided aspiration. Closed way. Open way, closed way. Okay? So in this question, they are going to make a little branch. They are going to ask you what are the advantages and disadvantages of each of these 2 ways. So it is so simple. The advantages of the open drainage are simple. Number 1, you are going to make proper drainage. You see already everything. It's open in front of you, so you can wash well, right? And aspire, take everything out. Number 2, you can make a stoma because you have an opening already. So you can decide what's going on there. If you need a stoma, you want to do it. Okay? These are advantages. What are the disadvantages? You made a wound, so there may be a complication of wound infection. Number 2, there will be morbidity, hospital stay, resources consumption, right? Yeah. This is the open drainage. Let us go to the image-guided aspiration. Image-guided aspiration, what are the advantages? Advantages are, number 1, there will be, actually there is no wound, right? No opening or a minimal opening. So most probably there will be no infection. This is an advantage. The other advantage, second advantage, they are opposite to each other, opposite to that. Look up and make the opposite of that. Secondly, second advantage is that there is less morbidity because there is almost no wound. So less hospital stay, less consumption of resources, right? What are the disadvantages of image-guided aspiration? The disadvantages of this method are the opposite of the advantages of the open drainage. Okay? In open drainage, you can drain properly. Actually, one of the advantages also of image-guided aspiration, you can make something called pigtail catheter. So you can frequently aspirate, and you can also apply some local antibiotics. This is another third one you can add also for the advantages of image-guided aspiration. So the disadvantages, number 1, is there you make proper drainage. So the disadvantages in image-guided aspiration is that you may not be able to make proper drainage. That is why you put this pigtail and you make frequent drainages. The second in the open way, you are able to make a stoma, right? Here you cannot make a stoma. It's not possible for you. So this is the second question. Diverticular abscess, its management. Third and last question in the main stem of this station, because every station has a stem and other branches. What is the classification, or do you know any classification for the complicated diverticular disease or complicated diverticulitis or diverticular abscess? So classification, there are 4 classes, okay? The name of the classification itself is called Hinch's classification. 4 stages for the diverticular abscess. First stage, you may have a pericolic or mesenteric abscess. This is stage 1. Stage 2, you may have a walled-off pelvic abscess. This is stage 2. Stage 3 in diverticular abscess, or complicated diverticular disease or complicated diverticulitis. The third option for you is generalized purulent peritonitis. What is the 4th stage for this, for the complicated diverticular disease or diverticulitis or diverticular abscess? It is generalized fecal peritonitis. And as you know, if you have purulent peritonitis, peritonitis, and you have, if this will be unfortunate actually, if the patient had a generalized fecal peritonitis, you are going to move to the first branch of this station. The main stem finished. The first branch will be about SIRS, sepsis, severe sepsis, and septic shock. There is also another 3rd branch that also we are going to mention in a 3rd lecture or 3rd lesson, okay? So till here, you know all the questions for the main stem of diverticular disease or diverticulitis. You know the proper answers that are needed by the examiner. And if you want to know more about the branches of this station and you want to get the full mark, you can follow the next lesson. Thanks, and see you later.